Good day, everyone. My name is Trisha Angie Martinico from BSN2D, and today I will be doing the bag technique. So, the bag technique is a tool in which a nurse, during her visit, will enable her to perform the nursing procedure with ease to save time and energy, and for her to, with the end of the view of rendering effective nursing care.
Front of the bag left to right, oral, rectal, and digital thermometer. On the right rear of the bag are test tube and holder, medicine dropper. Left rear end is medicine glass, baby scale, bandage, scissor. Back of the bag from left to right, 70% isopropyl alcohol, Benedict solution, PNSS, denatured alcohol, povidone iodine cleanser, povidone iodine solution, and acetic acid. Center of the bag, Kelly forceps curve and straight, surgical and bandage scissor, roller bandage and cotton pledges, empty alcohol lamp, match, tape measure, cotton balls with extra and test tube rack. Top pile in the center, hand towel, liquid soap, and apron. Sides of the bag, outside the lining, sterile os, waste receptacle, clean gloves, waste receptacle with plastic lining, clean gloves folded in paper pockets, colored chart for urine testing, eye chart, physical assessment, and extra pouch. First, greet the client and introduce yourself and explain the purpose of the visit. Then take the plastic lining from the top of the bag, lay plastic lining on the flat surface of either table, chest, or box. If none, use floor, ensuring that the inside of the plastic lining touches the table, chest, box, or floor. Place the bag in the left side of the plastic lining. Open the bag and tuck the handles underneath the bag and take out the towel and soap. Close the bag without locking it. Ensure that the bag is not exposed to the air during hand washing. Then, perform hand washing. After washing your hands, open the bag and remove the apron from the bag and put it on. Observe proper technique. Make sure that the apron is folded in such a way that the inside of the apron touches the bag. The outside of the apron should be the one exposed. Next is to remove the bag articles that is needed for care. Complete care and wash your hands, and after that, return all articles to your bag. Remove and fold the apron inside out and place it in the bag. Ask the family to dispose paper receptacle and then close the bag without locking it, and then tuck the handles and lift the bag. Insert the plastic lining on top of the bag and lock the bag. And that would be all. Thank you.
Good day everyone. My name is Angie Martinico from BSN2D, and today I will be performing urine test to a patient in which is to determine the sugar in urine in Benedict's reaction. So little overview. Urine testing is used to check the presence of sugar, acetone, bacterial and other urinary products, and it is also used to aid diagnosis. First is to assemble the equipments to save time and energy. Then before doing the procedure, wash or sanitize your hands. And explain proper collection of urine, then don clean gloves. Benedict's test, we should place 5 cc of Benedict solution in a test tube. So, assumingly, this is the Benedict solution and the test tube. And then, we should add 8 drops of urine. So, this is the urine. And we should add 8 drops to the Benedict solution. After that, heat the bottom of the test tube until boiling point and read the result. Then, compare it to the colored chart. Then after that, we must perform aftercare. Good day everyone, my name is Angie Martinico from BSN2D, and today I will be performing wound care and bandaging. So before we start with this procedure, always perform hand washing, which is washing your hands with soap and water or doing the sanitizing. The next is to provide patients privacy and introduce yourself first to the patient. Use 2 patient identifiers. Verify allergy status, perform environmental safety checks. Also, you must prepare all the supplies that is needed for you to save time and energy. The next is to provide patient education for the safety of the patients. So first is to introduce myself to the patient. Hi, Miss Nicor. My name is Trisha, your nurse for today. Now, I'm going to perform wound care and bandaging to you. So, are you okay with it?
Yes, I am okay with it.
Don't worry, it will not take long. So, let's do it?
Sure.
Now, I'm going to sanitize my hands with this alcohol. And I'm going to let you do the same. I'm going to put my clean gloves on, and after that, I'm going to take my hands in Miss Nicor's arms and then slowly take the bandages. Slowly. Then after that, you should discard it. The next is to take off your gloves, then clean your hands with soap and water, and then get the second piece of your gloves, and now we're ready to go. Now I'm going to take 1 gauze and hold against the arm of Miss Nicor. You must clean it from the inner to outer in round motion. Then dispose. Another one. Once you clean the wound, examine it to see any changes of color, odor, or the drainage of the wounds. If there is purulent drainage, then consult to the doctor immediately. After I clean the wound of Miss Nicor, I will get 4x4 gauze pad and then put a saline water. So let's assume that this is a saline. You don't want to make it wet or soggy because we're going to put it to the wound base itself. So I'll take the hand of Miss Nicor and then put it directly to the wound where the tissue is. This will serve as a first dressing. Then after that, I will take on the secondary dressing to cover the first dressing. Presumably, this is the second gauze secondary dressing. So we're going to put it here and then put plaster to lock it. Lastly is to remove and discard all used materials like this gloves. And after that is to wash or sanitize your hands. And that's it.